Are you surprised that it's taken this long to declare COVID almost over?
Well, I think so, Patrick. When you, I suppose the first thing to look at, people are still dying kind of due to COVID when you look at the official ONS figures, but they're relatively low now. They're about around 30 to 40 a week compared to over 1,000 that we were seeing in the UK at its peak. So different countries, though, Patrick, have kind of tapered away from COVID measures at different times. In the UK, obviously, Boris was kind of rejoicing that we were one of the earliest to do that. So in the UK, it probably does seem that we've been past the kind of the pandemic and gone through it all and been living with COVID for a while. But, across the pond in the US, they've just banned Djokovic from going to the US Open because he didn't have a proof of a full vaccination, where you could go in if you're not vaccinated and you're not you as a US citizen. And this week we've seen New Zealand get rid of all of their kind of their masks and their COVID certificate vaccination kind of mandates as well. So different countries have been moving at different times, Patrick. But the irony of it all is where it all started in China, they're still going on with this zero COVID policy. So they're not listening to the World Health Organization. You get a case or two in kind of China, huge lockdown, zero COVID is still what they're aiming for.
Yeah, indeed. Is it true that Denmark are now banning the vaccine for anyone under the age of 50, apart from those with very, very special medical exemptions or something or medical requirements, I should say?
Well, I suppose you're using the word banning the vaccines probably a bit more. What they're saying is that, a bit like where we got with the flu vaccination now, is that we're getting into that stage where probably don't need to do max vaccination for all. We do know from kind of the ONS figures as well, if you look at, because the variant, it kind of evolves to become more infectious, which is what we saw with Omicron, but less deadly. That actually, when you compare the latest ONS figures and deaths, when you compare people who've had vaccines and those who haven't had vaccines, the death rate is pretty similar for younger age groups. So there's no real overall benefit when you're looking at it at the kind of a macro level. It will vary, I suppose, Patrick, for people who are younger, who got more kind of vulnerable within those age groups. There is that benefit for older age groups. So I think what they're moving to in other countries, similar to the UK's booster rollout, is to focus on those kind of age groups where you would normally focus on the flu vaccination, which are those at the highest risk. So where we were this time, kind of a Christmas ago, where Boris was saying, boost everybody back down to 18, I don't think we'll be going in that kind of way at the moment now in terms of the UK. And we've got to remember now, Patrick, we are seeing higher than expected number of deaths across the country at the moment. And most of that is non-COVID related when you're looking at the death certificates. So we've got to remember that part of the pandemic as well.
Well, one could make the case that it's more damaging to public health to continue with any kind of bizarre COVID legislation or restrictions or anything like that, or reintroduce them, as now something that I was saying for a very long time appears to be, and I was criticised for this at the time actually, but I appear to have been correct about it, which is that we will see the potential, at least, for more deaths as a result to our response to the pandemic than from the pandemic itself, Jamie.
Yeah, so those huge numbers that we saw, Patrick, during the early part of the pandemic, it's going to be difficult in the next year or so to get more non-COVID deaths compared to that. But it's clear when you're looking at the data. I've been writing some blogs, been talking across on GB News and other shows about this, in that we are seeing kind of heart issues, diabetes deaths higher than what you would expect for the time of year. And the lifestyles that were kind of caused by the lockdowns, where people were told, not to kind of go out. People were mixing and doing their park runs. People were staying at home, drinking more alcohol. We've seen all of these factors coming in, and the NHS kind of closed down for most courses other than COVID, Patrick. And we clearly see the fallout of that. Now, excess pressures on the NHS. Can't get enough care workers in the community to look after some of the patients, blocking up beds. We're seeing all of this at the moment. I'm surprised we haven't seen any kind of coverage of this for Liz Truss across the narrative, and the new health secretary, Therese Coffey. This is the big issues that we've got. But going back to the whole COVID thing, this is kind of what you would expect in a pandemic. You kind of get those big...
Yeah, now, I think after any major event, there's an inquiry. And I can't help but feel as though there's a little bit of a distraction going on here. There's going to be an inquiry into the way that we handle care homes. Absolutely fair enough, 100%. And I think that was a huge error, the way that we essentially, you could argue, knowingly, sent people back into care homes, or into care homes that weren't even their own, with the virus, and that led to massive deaths amongst the elderly. That is inquiry worthy. Whether or not we locked down soon enough or hard enough or should have locked down at all, that's worthy of an inquiry. But I can't help but feel like we're not getting to the root of this problem, which is where COVID actually came from and how it got out. And there is a new report from The Lancet, which does say that it remains, quote, feasible that COVID originated from a spillover from a laboratory? OK, because I don't buy this wet market stuff. I don't know about you, Jamie. I just absolutely do not buy this wet market stuff. The report says, yes, it could have come from China. It could have come from America. For me, the main thing here is whether or not it actually came out of a lab. Jamie, what do you think?
Well, I think it's really important, Patrick, because we talk about pandemics, don't we? Like 1 in a 100-year event. Well, if something's come out of a lab, that could be 1 in every couple of year event if you get a leak out of a lab, because these things will happen. If it's nature that's caused the pandemic overall, then those would be a 1 in 100 event. So it's quite critical. I don't think we're ever going to find out, especially if it started in China. We know how secret that state is, Patrick. We're never really going to find out if it came from the lab or not, I don't think. But if it did, then what's to stop, say, another leak coming forward in another 5 to 10 years? Because these could be used as, obviously, to alarm the public, bioweapons in a way, to kind of cause panic around the world. So, yeah, it's all very well looking at different countries' response to the pandemic. Understanding where it all started is probably the fundamental question for all, not just for the UK, but for every nation across the world. I think you're spot on, yeah.
What does bioweapons mean? I mean, they've softened it a little bit with the word biotechnology. I mean, what's all this about? Is this going to be something like almost? Could it almost be something like some sci-fi thing where they're trying to almost, engineer the perfect human? Is it something more similar? More sinister, I should say. I mean, we'll never know. Obviously, we will never know where this thing started. If anyone's to blame, who is to blame if anyone is? But are there things like this biotechnology, bioweapons that can cause something like this in future? Because that'll be the big fear for everybody else, won't it?
Well, of course, when you look across different countries, they've all been working on kind of chemical weapons as well, and you'll have bioweapons. A lot of those obviously restricted in terms of use, and they would be picked up. You've got things that have been picked up in the past, things like anthrax and stuff, Patrick. So labs will be working on these things. What they'll also be trying to do is looking at viruses to see how they evolve to try and come up with solutions for viruses. And I think we do need to know what the hell has gone on with this kind of pandemic overall. You're spot on with that. But I think it all comes down to, if it's come from any country, which country, even if it came from, say, the US, I'm not saying it is, but if it came from the US, the UK, any country, who's going to want to put their hands up to say, we accidentally leaked this virus? We don't know if that's the case. All the talk has come from China to start with, obviously, where they're still pursuing the zero COVID. But if it was a leak or it was nature, I don't think, Patrick,
we have to know. That's the thing. We have to know. Jamie Jenkins, thank you very, very much. Jamie Jenkins, our political commentator, independent statistician. We have to know one way or the other. I mean, it does seem to me rather bizarre that the focus does not seem to be on exactly how or where this thing started. It's more on our response to it, whether it was natural, whether it was in some form of lab. Surely the main point is that we know where it came from and how it happened, so we can really do our best to prevent it happening again.